We had some very, very bright and gifted students from Luxembourg, actually at our unit, who were learning medicine, and so I think that is a very good example for cross-border healthcare. And so finally, of course, we already addressed that the work of the Commission is very important. So we are very happy to have Annika Nowak with us. She is a member of the Cabinet of the Commissioner for Health and Food Safety, directed by Dr. Vytenis Andriukaitis. And so thank you very much for coming here and giving us the perspectives of the Commission.
Good morning, everybody. It's a great pleasure to speak here on behalf of Commissioner Andriukaitis. I would just briefly touch upon some of the issues you've already mentioned by the previous speakers, mainly the cross-border directive. Just to recall, in 2014, the Commission has adopted a communication on effective, accessible, and resilient health systems and defined 3 pillars for action for EU agenda on health systems. And one of them being increasing accessibility to healthcare. And in this chapter, we said that the optimal implementation of the cross-border directive is one of the main actions. So since the adoption in 2008, which, I mean, is some years ago, it's a long way and it's still a process ongoing to achieve an optimal implementation. In my previous position in DG Santé, I was involved, engaged in the negotiations, then assisted member states during a transposition period, and I was still able to launch a lot of infringement processes against member states for complete transposition. So by now, 2015, we are at least pleased to say that the directive has been almost completely transposed, completely meaning put in national law. However, and that's important, we need to address a different question: has the directive been properly transposed? And there's still a lot of work to be done. As already mentioned, regretfully, our first implementation report, which we adopted beginning of September, identified major obstacles which prevent patients from using their rights in practice. We see highly elaborated prior authorization systems in some countries. Some apply a very low reimbursement tariff, both things which prevent patients from using their rights. Later, my colleague from Santé will give you more details on this report. We are aware of this and we can see the obstacles in the law. It was also mentioned low awareness of patients of their rights, of the existence of national contact points, which are a cornerstone of this directive, which should provide the necessary information, which we can see at least it has already brought more transparency into health systems, to keep positive. And I can confirm, as Commissioner Andriukaitis has said during the informal Health Council, that the Commission is ready to act and to take appropriate action in the sense if we see that the member states' law are not having properly transposed the law and is not addressing it in a dialogue we enter now, we will take actions, meaning further infringements. Therefore, ensuring a correct and fair transposition is still a long process to go. And we very much rely on patients' organization to get feedback from the ground, what is working and what is not working. Because seeing the law is one thing, but getting the feedback, how it works in practice, which are the administrative obstacles placed when I try to get my prior authorization, and time is also a matter. This is important for us to know. Talking about the cross-border directive, I also want to highlight the establishment of European reference networks. This was included in the directive, and again, a very long process, where we're now close to finish in the sense that we will prepare a call of interest to highly specialized providers beginning of next year. So these networks will help member states with an insufficient number of patients with a particular medical condition or which lack of technology or expertise to provide highly specialized services of high quality to patients, probably abroad, or getting this expertise into their country. As we said, we are now preparing the call, and we hope that we will publish it beginning of next year. I learned from my experts in santé that juvenile rheumatism would be a medical condition which requires highly specialized healthcare and would be a candidate for European reference networks. I just briefly turn to another aspect of access to healthcare, which you also included in your recommendations, which is access to medicines and treatments. Also, the Luxembourg presidency has put this into their agenda, and I think it's a good moment to push this agenda further. Patients have very high expectations as regards medical treatments and call for speedier translation of research into accessible and affordable therapies. Since some time, there is some increased interest of member states to discuss, to at least jointly reflect how to increase patients' access to innovative medicine. Since last year, there's an expert group of the Commission discussing these issues and examining a bit how to optimize the existing regulatory framework to facilitate patients' access to innovative medicine. However, current discussions show that it's not just a matter of regulatory framework, but these questions are very much linked to reimbursement and pricing issues, both areas of member states' competence. However, the Commission will continue supporting the cooperation between interested member states, and we observe interesting projects of, for instance, Belgium, Luxembourg, and the Netherlands, how they could at some point jointly purchase medicine or negotiate prices and purchase medicines. So these are just two aspects of access to medicine or to better health care. I can go on with other things like e-health, but you will discuss it later. So and I wish you fruitful discussions this afternoon on all of these aspects. Thank you.